Many people are calling the COVID-19 hotline and their doctors to find out if the symptoms they're experiencing could be the coronavirus. While tests are happening every day, local healthcare providers have to follow CDC guidelines to best utilize the nation's limited testing supplies. One KELOLAND mom is sharing her story about what this means for the number of cases in South Dakota.
This has really taken her out. Yesterday was probably the hardest day as a mom to see her in so much pain.
Over the past week, Mandy Wendt has spent hours on the phone trying to find some answers after she and two other members of her family started showing symptoms of COVID-19.
My husband was actually advised to go to the ER. We end up going into the doctor and they're not testing. They say that I have the same symptoms and my daughter is showing the symptoms and we have the fevers, but that doesn't qualify for a test.
We don't test those individuals that either are mild level of symptoms, aren't sick enough to be in the hospital, aren't healthcare workers, or in the high-risk group.
Wendt says she knows her family is not a priority group and understands why healthcare workers have to follow the guidelines for testing. She made a Facebook post about her experience to make another important point.
It has nothing to do with the numbers they're reporting. That's the numbers that they're given for confirmed cases. But there's just a lot of people that haven't been tested.
The number of positive tests that we have right now could be as high as 10 or even 100 times more than that are actually circulating out in the community right now.
Healthcare providers agree there are likely many more people who have the virus that aren't getting tested right now.
Absolutely. If you're told that you don't meet the criteria for testing, you still could have the virus.
Avera Dr. David Basil says if you're not likely to experience severe symptoms, your doctor's orders will be the same whether you have a test or not.
COVID, whether you have influenza or another virus, we're highly recommending that you stay at home and isolate.
That's exactly what Wendt and her family continue to do.
But all are saying, treat it as COVID and stay home and stay away from people. And that's really hard to do without a diagnosis, especially for employers or daycares and things like that.
And Dr. Basil says the tests can also come back negative in patients who may have the virus but were tested too early before symptoms became more severe. Right now, officials are still encouraging anyone showing symptoms to stay home and call your doctor.
We'll get back to our coronavirus